A new study from the Brookings Institute suggests that a third of unfilled jobs in the U.S. remain that way due to disabilities caused by long COVID. According to the report, 16 million Americans between the ages of 18 and 65 have reported experiencing COVID symptoms long after infection, and 2 million to 4 million of those people are currently out of work as a consequence.
Our next guest has made the case that it is not too late to invest in understanding and combating long COVID. Professor of Molecular Medicine at Scripps Research Institute and founder of the Scripps Research Translational Institute, Eric Topol, joins us now to break down what we know about long COVID so far. Welcome to Rising, Doctor.
Thank you. Great to be with you.
All right. So I think there is a lot of skepticism about long COVID because there is sometimes a conversation that happens without talking about the concrete numbers. And there are people who say things like, well, how did we know that these aren't, comorbidities, or these aren't things that would have happened or that are caused by other factors other than COVID? What do you say to people who have that kind of skepticism?
Well, it's really denialism, not so much skepticism anymore. We have many good studies recently, particularly one from the Netherlands, where they had tracking of thousands of people before they ever had COVID and compared them to matched controls. And 1 in 8 people developed long COVID once they had an infection that lasted for at least 5 months. So that was before wide-scale vaccination and Omicron. So it's less now. We know that because there's some protective effect from vaccines and boosters, and Omicron is not as bad for long COVID as prior variants. However, even if it was half, the number substantiates 6% of people who were infected, gets you well north of 10 million people, as the Brookings Institute came up with 16 million. It's a big deal.
Another reason I think for the skepticism, I admit I've been somewhat skeptical of the whole concept for a long time. The range of symptoms that so-called sufferers of it describe, so vast, everything from things that sound like, sure, it might be something that would take a while to recover from if you have a bad bout of COVID, respiratory issues, cough, fatigue, not having taste or smell come back. Then also a kind of listlessness or inability to work, or kind of more neurological type things. The stress of going through COVID, that kind of thing. Is this typical of illnesses? Are there comparison illnesses where there's a long, whatever that illness is, that produces such a wide range of effects that are hard to understand how or why they would be connected to that specific disease, a respiratory disease?
Right. Well, this is part of what we've seen with post-viral syndromes, notably myalgic encephalitis, chronic fatigue syndrome, known as ME/CFS as abbreviation. But it can occur with other viruses for long duration, particularly involving brain fog and other symptoms that suggest a hyperinflammation. That's really what the common thread of long COVID is. We see inflammation of the nervous system, both in the brain and in the peripheral nervous system, that is the autonomic nervous system. And so it has occurred certainly and documented in other viral syndromes, but the point here is that we have so many millions of people that it's just become so palpable. Beyond that, of course, these symptoms kind of partition in different clusters. So some people have more of this postural tachycardia. When they stand up, their heart rate goes up to 120, 140, and they just don't have the same exercise capability, whereas others have more of these immune dysfunction signs. So, it isn't just one thing that is the same for all people with long COVID. It varies.
I think that's a really important point, that there are physiological outcomes, consequences that can be tested for. So you're saying that people, who say that they're presenting with these symptoms, they've been tested and diagnosed with things like tachycardia, accelerated heartbeat. When we talk about the brain fog, how are physicians assessing what is in fact brain fog and what is hypoglycemia, or someone just didn't, get enough sleep that night and things like that?
Right. Well, as I mentioned, when you have very large studies that track people before they have COVID, and then after with matched controls. That's the best way to do that. And we saw that with a remarkable brain MRI scan study that came out of the UK, where they showed atrophy of the brain and signs of inflammation of the brain, as well as cognitive decline. And that was recently verified by another study, similar study from Brazil. That's with having MRI scans, the UK study, before people had COVID, because they did a very large study called the UK Biobank. So the point here is that there's unequivocal tracking of what people, the symptoms, with objective data. And in fact, the recent Yale study showed 94% tracking of the people with these symptoms with objective signs. So low cortisol, low ACTH hormone, that localizes the problem to the brain, the pituitary gland. So there's no more denying that long COVID exists, but we have to help these people.
So, and what is the...
No, please.
Yeah, I was going to say, so what are we learning is the best way to cure or address or I guess prevent long COVID? Obviously, we're still debating various mitigation efforts to slow the spread of COVID. Although I think there's been a wider admission from many public health officials that keeping cases at bay became a lot harder with Omicron. We can't keep all of society shut down forever. We're not keeping all of society shut down in virtually any respect. But vaccination has helped so far, is what it sounds like you're saying. And is there a prospect that whatever new vaccines are going to be rolled out, hopefully to combat the newer strains, maybe based on different molecular properties for people who are concerned about mRNA? What's the long-term prospect for addressing this?
Right. Well, firstly, preventing it. The only way we know to prevent long COVID is not to get COVID. So that's a problem when we relax all of our ways that we know to reduce the likelihood of infections, transmission. But also there's this cumulative hit. We know that the studies that have looked at people with second infections of COVID or third, their chance of developing long COVID is increased. Vaccinations and boosters do help, but the magnitude of the benefit varies on the different studies, from 15 to 50% reduction. Your point about this new BA.5 booster, will that help? It might, because it's addressing the current dominant strain of the virus. So it's possible. We don't know yet. But the main thing is we have no treatments. There have been no big studies yet with any treatment that's been validated. And so there's so many people suffering, as you mentioned, up to 4 million Americans that are out of work because of long COVID. And so we need a treatment, but there's just not enough work being done to get one so that we know for sure that it will help.
Dr. Topol, this is a difficult issue, I think, for many people, including many viewers of this program, because the political implications of taking long COVID seriously are rather vast. So much of the arguments about whether schools should open and what kind of intervention should be put in place at school before they can open have to do with this understanding that the risks of COVID to children are relatively low. If long COVID is thrown in there as an additional risk, and children are expected to get COVID multiple times because of their presence in school, largely unmasked, then that changes the calculus. And I wonder what you make of what might be a kind of resistance to talking about or really acknowledging long COVID because of these political implications that don't necessarily follow, but that could follow taking long COVID more seriously.
Well, first, I think the data for children, particularly as you get younger and younger in children, the chance of getting long COVID is much more remote. So the concern really isn't in the children. I mean, it can occur. It's much more as you get towards higher teenage, people in their 20s. The vast majority of people who have had long COVID have had mild to moderate, that is not hospitalized, and they're between the age 20 and 50. So the children's story is not as concerning. I mean, it's possible. But the politics is just ridiculous. This whole idea, let's just deny this and have millions of people suffering, that's despicable, frankly. It is unquestionably a big issue, and it's going to be a long story going forward, because even when we get out of this pandemic, which looks like things are favorable right now, that we'll have a lull and hopefully we won't see some really nasty variant going forward. new family of variants. But even after this is passed, we've got to deal with this problem. We just can't try to, will it away. It's not going to go away.
Well, thank you so much for joining us. We really appreciate it.
You bet.
We'll have more Rising right after this.